Hey guys, Dr. Brown. I want to talk with you today about revisionary breast surgery. The first thing I will tell you with revisionary breast augmentation surgery, implant surgery, is that if you've had your implants for a long time and you're happy with the way everything looks, you don't need to do anything. However, when the moratorium was lifted many years ago for silicone implants, the FDA did make a recommendation that if you have silicone implants, you are supposed to get an MRI 3 years after you've had them placed, and then every 2 years thereafter to evaluate for rupture, because when a silicone implant ruptures, they're highly cohesive implants, so the gel just doesn't ooze out. But when a saline implant like this one ruptures, the salt water just leaks out and is absorbed by the body, and the breast immediately deflates and you know it. So those are the FDA recommendations. So now let's launch into, you have implants, but you're not happy. What is revisionary surgery like? What does it look like? Is it more painful than the initial surgery? So here are the different things that you could have. You may have implants and be happy with your shape and your size and simply just want them to be replaced. In that case, you've already been through the process of the muscle stretching, which is the most uncomfortable part of a breast augmentation. And if we're just simply doing an implant exchange, if you're going bigger, I might just have to make a little bit of room in the pocket to accommodate a bigger implant. And in that case, your recovery is going to be simple. You may have almost no pain whatsoever. Let's say you're someone who wants to change the size of your implant, but also maybe you've developed some laxity of the skin and some sagging of the breast over time, and simultaneously with either reducing or elevating the size of your implant, you also need a breast lift. Well, that does entail me making other additional scars on the breast in order to lift the breast. Now, what I will tell you is that is very similar to a breast reduction, and in my breast reduction population, those patients hardly have any discomfort after surgery. So the implant part of the exchange for you would be just like what I described before, where you're gonna have very little muscle pain related to that. But with the mastopexy portion of the procedure, you're gonna be what I like to call skin sore, meaning they're just skin incisions and tissue manipulation, but we're not messing with the muscle at all. So that's typically what revisionary surgery goes like. Now, there's one other thing that I do want to talk about that I do think is important that does add a little bit of discomfort to the procedure. During a breast revisionary surgery, sometimes I have to fix the pocket. Let's say the pocket is stretched too wide, or we're going bigger, and like I already talked about, we need to make the pocket bigger. But let's focus on if we need to make the pocket smaller. In order to do that, I have to actually suture the pocket together to close things down to accommodate the new implant. And in that case, I will have patients tell me after surgery that they generally feel sore on the sides. Because let's face it, one of the most common things I see for revisionary surgery today is when a woman lays down flat after having implants for a long time, she complains that they stretch or fall off to the sides. That's something natural that just happens to the pocket over time. Your skin is gonna stretch, as well as the capsule, which is the tissue layer surrounding the implant, is gonna stretch. And so in that case, I may need to, at the same time as your breast surgery, revise the pocket and place a row of sutures along the sides to tighten up the pocket. And that can leave you a little bit more sore. That's about all you need to know about breast revisionary surgery. I mean, it really covers everything. So the only time you're gonna have a significant amount of more discomfort is with either a pocket revision or adding a mastopexy. If it's just a simple implant exchange, the likelihood is that you're gonna be smiling the next day and not really have much discomfort at all, but I will still hold you to the restrictions that I tell you in the office. So I hope that sheds some light on that topic for you, because it's a very common topic that I hear all the time. We'll see you next time. Have a great day.